Hello fellow classmates. Today I am sharing with you how I developed my community health project for a class assignment. I will share a summarization of what my community project entailed while explaining the planning process and why I chose my topic. I will describe each step of development and explain how I implemented my completed project. Achieved outcomes will be identified and goal outcomes will be discussed. To summarize my project with you, I worked with the Head Start program to educate low-income families on infection prevention and control. The Head Start program assists low-income families with early education, financial help, housing resources, health screenings, and so much more. I collaborated with the program's director and health manager to educate their low-income families on infection prevention and control to help keep kids healthy and in the classrooms. As children enter the classroom, while they are ill, it causes many other kids to also miss school, leading to multiple children missing out on many of the resources the program has to offer. My goal is to keep kids healthy and in the classrooms and reduce the number of ill students. My long-term hope is that this information will stick with these families throughout their school years to keep future classrooms healthy. Section 1. Planning. When planning for my topic of choice, I determined the important factors that would be essential for project completion. I knew that I wanted to be passionate about my topic so that I could stay motivated and determined to make a difference in my community. Being able to relate to my audience was very important to me. I wanted to gain the community's respect and trust in healthcare workers. Looking ahead at all requirements, I wanted to ensure that the topic I chose would meet the class requirements. How did I decide on my topic? Prior to my adoption, I grew up in the foster care system and was enrolled in the Head Start early education program and benefited a great deal. I know that the program offers assistance and resources for low-income families within the community that are raising young children. Now, years later, my mom became an employee with the program, and I learned so much more about what they offer and how the families need health education to keep their families safe and healthy. Being a toddler mom myself, I know the struggles of keeping kids healthy and the struggles we all have as parents. How I discovered what I would educate on. The program primarily works with low socioeconomic families, and knowing the social demographics of this population, I know there was a major opportunity for health education. Many of these families have low education levels, live in crowded environments, and have limited access to health care, each of which contribute to poor health management and prevention. I decided pretty quickly that I wanted to educate these families on infection prevention and control, seeing that it is a major issue throughout the classrooms. Section 2. My project development. First, I collaborated with the Head Start staff in developing my project. I knew that I first needed to meet with my site to present my project idea and access permission. They expressed their concern with the number of kids that come to school ill, have to be sent home, and how quick their classmates and classroom staff are infected. Staff explained that these kids rely on the resources in the classroom, on how illnesses force them to miss out on these necessities. After collaborating with the staff, I performed extensive research. I looked up my target audience. I acquired information about their needs in the community and became knowledgeable about their determinants of health. I learned about their determinants of health and how to better reach their population. I also researched infection prevention and control. I researched when to keep kids home from school, when they need to seek medical care, and when they may return to school. I obtained information on ways to prevent and control infection within the classrooms. I began putting all my research together. I broke down terminology and concepts so that the families could clearly understand what was being presented to them. I gathered information and separated them into small sections, such as hand washing and how and when to properly wash their hands, the do's and don'ts to teach children, such as coughing into their sleeve, not sharing utensils, and when to tell an adult when they see someone ill. Symptoms requiring kids to stay home, including fever, temperature, lethargy, and vomiting. Symptoms requiring medical attention, such as symptoms of strep throat or pink eye. And when it is okay to return to school, and resources to call and refer to when they are unsure. My project has had some limitations. Due to COVID and privacy of the families, I could not present face-to-face with my targeted audience. However, I was able to present to the Head Start staff, who agreed to send a recording of my presentation to the families in their next monthly newsletter so that they could capture the entire presentation details. For my targeted audience, I made a packet for families to be sent home with the kids. Next, I gathered my educational materials. For my in-person presentation with the staff, I presented a detailed PowerPoint presentation. We also did a hands-on activity with glitter to demonstrate how easy germs transfer from object to object. I also gathered an information packet for my targeted audience. I gathered an information page introducing myself and the purpose of my project. I designed an infographic with summarized information. I provided flyers with educational information on hand washing. I also provided fun posters for kids to see as reminders to wash their hands and to cough and sneeze into their sleep. I provided a quiz to assess the family's knowledge and a survey for families to evaluate what they thought of my information and if they thought it was beneficial. I informed the families that there would be a $25 gift card for the prize winner, that if they participated in the quiz and the survey, that they would be placed in the drawing. Section 3, How I Implemented My Project. My in-person presentation with staff was as if I was acting I presented my project to Head Start staff acting as if they had the demographics of the families in my targeted audience. I passed around a pen that had gold glitter on it, then passed around a clean purple ball. This showed that after touching the infected pen, the germs were easily transferred to the purple ball. My project was recorded to be sent by the health manager in the next monthly newsletter, so my audience could get the full presentation. I designed family packets. The classroom staff were willing to place my packets in the kids' book bags to take home to their families. Instructions were attached to review the information, take the quiz, and complete the survey and return to school for teachers to collect to be entered into a drawing for a $25 gift card. A small percentage of packets were completed and returned. To make the drawing fair, I placed each family's name in a bag and had the Head Start director draw a winner for the gift card. The gift card was placed in the child's bag to take home to their family. Lastly, the evaluation of achieved goals and outcomes. Families who participated did very well on their quizzes. Those who returned surveys had very positive feedback. Many families reported that they would utilize the information as a resource when their child or other household member becomes ill. Thank you all so much for taking the time to learn about my community health project.